Which conduit is better for coronary artery bypass grafting, the radial artery or saphenous veins? Now in JACC, researchers present radial and saphenous vein graft occlusion results more than 5 years following coronary artery bypass graft surgery. In the radial artery patency study called RAPS, complete graft occlusion was less frequent in radial artery compared with saphenous vein grafts at 1 year postoperatively, while functional occlusion and low TIMI flow was similar. The researchers looked at more than 500 patients who underwent elective CABG grafting in 9 cardiac centers. Target vessels for the radial artery and study saphenous vein grafts were the right and circumflex coronary arteries, which had more than 70% proximal stenosis. The radial artery conduits were randomized to either the right or circumflex territory, and the study saphenous veins were used for the other territory. The primary endpoint was functional graft occlusion by invasive angiography at least 5 years following surgery. Only about half of the patients underwent late angiography. But using these angiograms, the researchers showed that the frequency of functional graft occlusion was lower in radial arteries at 12% compared to 20% of saphenous vein grafts. The frequency of complete graft occlusion was also significantly lower in radial compared with saphenous vein grafts at 10 versus 19%. So the answer to the question I asked at the beginning is that radial arteries are associated with reduced rates of functional and complete graft occlusion compared with saphenous vein grafts more than 5 years following surgery. I'm Peter Block, and this is a CardioSource Heart Minute.